This largely green area at the top left is the part of the model that most users will probably focus on first. And the charts across the middle of the screen basically track how people move through the disease stages over 180 days. You can actually extend that timescale, but 180 days is a good time horizon to start with. At the left we have the total population starting out being susceptible to the virus and uninfected. Over time they move across to the right, first of all becoming new cases each day, and that number of new cases per day accumulates to give the total confirmed cases to date. From there, of course, the vast majority of people will recover, but a small fraction will die, and the next chart shows the number of reported deaths per day, and the final chart shows the cumulative total of deaths to date that the model is calculating. It's important to note that the number of new cases actually confirmed and reported, the number of deaths confirmed and reported, is a fraction, often quite a small fraction, of the total number of cases that are truly out there. The chart at the lower part of that section allows you to compare the number of current active cases with the total number of hospital places and intensive care places. Along the top is where you set up the data for your region, population, mortality, the number of hospital ward beds and ICU beds, and a set of assumptions about local conditions, how actively people contact each other in the normal course of their daily lives, how many of the contacts between people pass on the disease, and various other factors. To the right there's a small section that gives you information on this R0 and R factor that we hear so much about. This is basically the number of new people who get infected for each person who is currently infected. And R0 is the number that would be infected if everybody was susceptible, as shown in the blue, and R is the effective R factor, which is how many people get infected, given that not everyone is susceptible to the disease. To the left there are scenarios. You will be able to set up scenarios for yourself, but just to illustrate, if you click on any one of those scenarios, they will show different results depending on various assumptions that you make about the management of the disease. Having set up that base case, most people will then want to, or what would happen if various actions are taken or conditions change to cause the progress of the disease to be faster or slower, and you make those changes in these mauve areas of the model. To the left you can set how much difference it makes if various steps are taken to improve the hygiene surrounding the disease. Then you can explore the impact of both voluntary and enforced cuts to the rate at which people contact each other. Two further policies that you can test are what happens if you isolate the most vulnerable people in the region for a period of time. And you can also test the impact of policies to test and trace people who have the disease, so you can change the number of tests that are carried out and the impact that has on cases and deaths. Finally, you'll be able to actually compare the model's results with reported data for your region, reported data on the rate of cases and the rate of deaths being the key items. Now, to do that, you'll actually have to go and collect daily information on those cases and deaths. There's a table for you to copy that data from a spreadsheet. Then you can adjust the timing and scale of the model itself, so it matches the time scale over which cases actually occurred in your region. Having got the timing and scale of the cases and reported deaths correct, you're then in a position to go back up to the main part of the model and explore the impact of alternative strategies for managing the disease going forward. More advanced users may want to go and look at and maybe even modify the underlying model itself, and you do that by double-clicking this object at the top left of the model.